Okay, thank you. Good evening. I want to welcome everybody to the monthly town hall meeting for Scarborough-Guildwood. It's my pleasure to be here. I'm City Councillor Paul Ainsley. I'm the City Councillor here in Ward 24, Scarborough-Guildwood as it's known. It's my pleasure to be hosting this evening. I'm here with my provincial colleague, Mitzi Hunter, MPP, and my federal colleague, MP John McKay. And we have a special guest this evening, Toronto's Medical Officer of Health, Dr. Eileen Davila. And I'm going to begin by Mitzi, if you would like to say a few words.
Well, thank you, Paul. It's really a continuation of the monthly virtual town halls that we've been having for the residents of Scarborough-Guildwood. And, you know, I can't think of a more important day than today when we are in our second provincial lockdown to have this conversation for the residents of our community. So I'm delighted to be here. I want to take this opportunity to wish everyone a happy new year, and we look forward to things getting better in 2021.
Thanks, Mitzi. And John McKay, our MP.
Thanks, Paul, and thanks, Mitzi. And it also gives me a great deal of pleasure to welcome Dr. Davila to this program. These town halls have turned out to be quite a great way in which to communicate with the constituency. And like Mitzi said, I can't imagine a better day for you to be present on this town hall as we are going through this lockdown, but also there's so many questions that are coming from our constituents to all of us, and it's really a delight to have you with us. So with that, back to Paul, and let's get to the questions.
Thank you, John. And it's my pleasure to introduce Dr. Eileen Davila. Dr. Davila is the Medical Officer of Health for the City of Toronto. Our Public Health Department is Canada's largest local public health agency, providing services and programs to 2.9 million residents in the City of Toronto. Dr. Davila received her degrees as a Doctor of Medicine and Master of Health Science from the University of Toronto, and holds a Master of Business Administration from the Schulich School of Business. She is also an adjunct professor at the Dalai Lama School of Public Health at the University of Toronto. So Dr. Davila, we'd really like to welcome you here this evening. I know your time is very busy, and so I think we're going to get right to the question and answer portion. So the first one, how do the new rules affect Toronto residents that have just been put in place?
So, you know, first of all, let me just say thank you, first and foremost, to you, Councillor Ainsley, MPP Hunter, MP McKay. It's a real pleasure to be here. I will say this, right, as the local medical officer of health, the way I see myself is as the doctor to all 3 million people who call Toronto home. And with that in mind, for me, probably the highlight of the job is getting the opportunity to actually connect with patients and to answer the questions and to have real dialogue and engagement, because this is really what it's about, right? What do we do together to create Toronto as the healthiest possible city to be in? And I admit at this point in time, in the middle of a global pandemic, in the depths of winter, where we're seeing a lot of COVID-19 activity, it's hard to think about ourselves and to think positively about health and you know, the bright future that we should be thinking about. You know, at the beginning of a year, there's often a lot of hope, but here we are in the midst of a pandemic, you know, in the depths of winter and at the start of another lockdown, which we're just about to speak about. But there is hope, right? We know more about this virus than we did a year ago. We actually have a lot of science behind us. We know what makes a difference in terms of reducing spread. And we are just starting to get vaccines and to put vaccines in the arms of people all around our city, throughout the province and the country. And with these things together, we will be able to move forward. So let me just start off with those opening remarks. Now, in respect of, you know, what does the latest lockdown mean for Toronto residents and what effect might we see on all of us? Well, you can look at the details of the provincial orders, and there's quite a bit there, and it's written in legal language, and there are a number of different rules and regulations and what have you. But for me to speak to you about what really matters, I'll put it very simply. You can read all the documents, but I can probably boil it down to a few points. If you are fortunate enough to be in a situation where you can work from home, please do that, right? Along with that, I would ask for those, who are not working right now, stay home as much as possible, right? For everybody, stay home as much as possible. This is really the best advice that I can offer. Only go out for those activities that are essential. And when I speak about essential activities, we're talking about, work that must be done in person, that cannot be done, remotely. And this includes a number of people. This includes healthcare workers, and there are a number of essential workers who are frontline heroes. They're making sure that we have the goods and services that we need, whether it's in groceries or pharmacies or, places like that. We need these services and goods in order to live our daily lives. And so for that, we thank you. But essential work, healthcare, or other essential services, that's one essential reason to go out. To get groceries, to get pharmaceutical products, to get healthcare, and to get some exercise. Keeping in mind that exercise is a little bit about physical health and a little bit about mental health and just good for your soul. I mean, I think these are the kinds of things that we all need to do. So if people can stay home as much as possible, only going out for those activities that I've just described as essential, that is the first and most important thing that we can all do. If you are outside for one of those essential activities, I would advise that you wear your mask, right? Wear your mask whenever you are outside your home. This is the safest thing you can do to protect yourself and to protect others around you. I would ask you to wash your hands, especially after you've come back in from being or doing one of those essential activities outside. And of course, if you're sick or you think you might be sick, stay home. Only go out to get tested if you need to, or to get health care if that's what you need. But other than that, really the key message is distance, distance, distance. The more we are able to keep our physical distance from people we don't live with, the more we're able to reduce the spread of COVID-19, the more our vaccines will be effective as they roll out, and the sooner we can put this pandemic behind us. So that's fundamentally what our current situation means for the residents of Toronto.
Okay, and thank you, Doctor. And one of the things that I've been asked a lot, we tell people to stay at home, only go out for those things that are essential, and as you say, go and get exercise. And there seems to be some people say if you go out to do your 10,000 steps, you should be wearing a mask, and other people are like, no, it's fine. Do you have any recommendations around that, or is there a train of thought? If I'm just going out to do my 10,000 steps, should I have a mask on, or?
Yeah, so here the best advice right now is that as much as you can wear your mask when you're outside, the better off you are. So I think, but very practically speaking, if you're out and about exercising and you literally run into nobody, and that does happen depending on what time of day you're out and about, and or what time of day or which area, I guess, you're in, and at what time of day. So if you're running into nobody, you're not at risk of exposing anybody outside or contracting COVID-19 from somebody else. But the challenge is that you can never really tell, right? We live in a big, busy city, right? So again, if your exercise is at, the wee hours of the morning, and I know that some of us like that, and you really don't run into anybody, then I can understand that is doable. But still, to my mind, the best advice is the more you can wear your mask when you're outside, the better off you are. It's just the safest thing to do, both for yourself and for anyone you might run into.
Okay, perfect.
Paul, I just wanted to follow up on some of the comments from Dr. Davila, where you talk about working from home as much as possible if you are able to do that. So many of our residents in Scarborough-Guildwood are some of those essential frontline workers. They may work for the Transit Commission, or they might be a personal support worker. So they don't have that ability because they are literally the frontline essential workers. And, you know, they have not had a break from the pandemic. Even though we're in a lockdown and it feels like the restrictions are greater today, many of them haven't had that. So what message do you, as our doctor, I really liked your introduction, you know, that you're Toronto's doctor. What message do you have for some of our residents in Scarborough-Guildwood who have just seen higher infection rates since March?
So first and foremost, my message to the people who are doing this essential work and who really have not had a break, as you say, is thank you, right? I mean, first and foremost, it really is thank you. You are the heroes of this whole thing. Without you, none of us would be able to know that we're in good hands for healthcare. We wouldn't be able to have food. We wouldn't be able to get on with our daily lives. And I think ultimately we owe you, a real debt of gratitude because this is significant. I think the other thing I can say right now is, for individuals, to the extent that you can, right? If you're an essential worker, right? I would ask you to do your best to look after you because, it is difficult to be out there every day, right? I know that myself. Mm-hmm. And so the first piece of advice I would say is to, as best you can, right? Do try to eat reasonably well, right? Eat, healthy, balanced diet wherever possible. And I realize that with a busy schedule, that's not always easy. But to the extent that you can have, fruits and vegetables and maintain a healthy diet, that's a good thing. I would say that sleep is also incredibly restorative and is really important in terms of maintaining one's own health. And of course, I would say to try to get out, to get some physical activity and to get out into nature as much as possible whenever you can. And I know that that's not easy. I realize these are not always doable for everybody, but to the extent that they are restorative, I think, for each and every one of us. And I think that that's really important. I think the other thing I would say as well is that, of course, you've got to, wearing your mask as much as possible becomes really, really important. And to essential workers, I would encourage them to really pay attention to all the infection prevention and control guidance that's provided for their specific workspace. And if they're not sure what that is, there are many ways to try to figure this out. From a work perspective, right? The Ministry of Labor Training and Skills Development has a lot of information for workers available so that you can understand what are the expectations of employers and what sorts of things should you be looking at depending on what sector you work in. But to the extent that you have the personal protective equipment and that there are rules and protections in place, really make sure that you're keeping up with them as much as you can and trying to follow them as best as possible. This includes the time on the job. And then when you're commuting back and forth between work and home, make sure that you are wearing that mask and wearing it properly. Have it well fitted, that it's not with gaping holes, that you wash your hands when you get home. I mean, I think these are the kinds of things that are most important. And please know that, we are working as hard as we can to try to create an environment that's as safe for you as essential workers as possible. We're trying to provide information. We're trying to create circumstances that make it easier for you to know that you're protected, whether it's through things like a masking bylaw, right? These are the kinds of things that actually create safer spaces for all of us, but especially for those who have to be out and about in their daily lives. I think the other thing that I'm very interested in making sure that we push forward, and we're working really hard on this with a number of other partners, is that we have asked for the provincial government or the federal government to really step into roles that have to do with income supports for when essential workers, should become sick or get exposed to COVID-19. There are a number of protections now, but I think that there's more that can be done in respect of paid sick leave, for example. These are the kinds of things that I think will make a difference. Along with perhaps increased testing in certain work environments, particularly those environments where we know COVID-19 is more likely to spread because of the nature of the work and because of the nature of the work environment. So please know that we're continuing to work really, really hard and to try to create environments that allow for your best protection. And at the individual level, we would just ask that you continue to do your best with the self-protection measures, watching your distance, wearing your mask, washing your hands, staying home when you're sick or if you think you're sick. I think when we put all these things together, we create the best chance for us to reduce spread in the community.
Perfect. Excellent. And Dr. Davila, the second question is for you as well. I understand that Pfizer and Moderna vaccines use messenger RNA technology, never before used in vaccines. Both vaccines are approved for emergency use in the US, the UK, Canada, and other countries, but neither is yet fully licensed. Is this correct? And then the second part, is the vaccine safe for people with compromised immune systems?
So this is an excellent question. And first, I'll start off with the fact that the very fact that we have vaccines only a year after this virus was first identified is a modern miracle of science in and of itself. So yes, these new vaccines, the Pfizer and the Moderna vaccines, use messenger RNA technology. This is new vaccine technology. But in order for those vaccines to have been approved for use in Canada, that's done at the federal level, but in order for that to happen, these vaccines have to have gone through the very rigorous process that's set out by our colleagues at Health Canada. And it is no different. What these vaccines went through is no different a process than what any other vaccine would go through, regardless of what the technology is. So that's the short version of the story. I will say that because of the importance of licensing these vaccines, what was, on top of the amazing technology, I would say that our Health Canada colleagues and colleagues who are regulators all over the world, they did things differently with vaccine manufacturers in order to get information flow moving more quickly, because they knew they wanted to do the same rigorous process, but in as short a time as could be done while still meeting all the standards of safety. So the fact that these vaccines were approved for use in Canada means that they have passed that rigorous evaluation. It is the same evaluation that any vaccine would go through, whether it's new technology or otherwise. And that's why they're actually being used now in Canada and in many other countries in the world. With respect to immune compromised individuals, here's the thing: because the vaccines were approved, again using that rigorous process, but in as brief a time frame as possible, recognizing how important it is to have these vaccines, there hasn't been a lot of testing on individuals who have immune compromising conditions. So there isn't definitive information around the vaccine usage in people who have immune compromise for various reasons. However, as part of the process of approval, Health Canada has indicated that it is reasonable for people who have, various forms of immune compromise to receive the vaccine, and it's believed to be safe. But the best thing to do is for those individuals to consult with their physician, their treating physician, to have that discussion about their unique circumstances and the value of taking the vaccine in their circumstances. But that's really the best advice right now. But there isn't any reason to believe that there is a safety issue whatsoever.
Okay. And that would be, I know I read there's a nursing home, I believe it was in Montreal, where they said 7 people that have been vaccinated had contracted COVID. And would that mean that it was already in their system more than likely once they've been vaccinated, or they've been exposed to it?
You know, without having all the details, it's difficult for me to give a definitive answer. But because COVID-19 is so prevalent in the community, right? And we know that there is such a thing as an asymptomatic infection and an asymptomatic period. There's a pre-symptomatic phase of infection. I won't be surprised if some of those individuals, if not all of them, actually had COVID infection. They were already exposed, were sort of cooking an infection, if you will, got the vaccine, and then ended up manifesting symptoms of COVID-19. That's the most likely story in those circumstances, but I can't be, without knowing the details, it's hard for me to be really definitive about that.
Paul, I just wanted to make a point with respect to the Health Canada approval process. Health Canada is obviously under a tremendous amount of pressure to accelerate the process and have in a efficacious and I would say very safe fashion, as Dr. Davila has mentioned. But people forget that these drugs do have some risk to them, and I just remind people that it's not so long ago that we had thalidomide babies, which was obviously a negative effect out of a drug that was for women who were pregnant and having morning sickness. So the pressure is on. I'm very satisfied that the protocols are being followed, but this is serious stuff, and you know, people want it done yesterday. I'd rather have it done tomorrow and know tomorrow is right than have it done yesterday and have some doubt about whether it was done right.
Yeah, I think that those are all that's excellent points. And I think that that's what speaks to the real importance of that cooperation that's happening, frankly, across the country, right? Collecting data to understand what are the experiences, but even more so globally, right? You need to have the numbers, and you want to make sure that you're constantly evaluating what we're doing. I think that's been the hallmark, if I can, of this pandemic response. That, you know, in order to provide the best response, one uses science, makes a decision and a determination, watches what the impact of the decisions are, right? It's like any treatment. We understand the science behind the treatment. We understand the diagnosis. You provide the treatment, you observe, and then you adjust your treatment in accordance with that which you see. I think that's good, responsible public health practice, and it's good, responsible medicine. And it's the kind of thing that we've been doing throughout the entire response.
This might be a slightly unfair question, Dr. Davila, but if you have good data, you can go through that process. If you have not such good data, you end up with skewed results. Are you satisfied that the data that comes out of the government of China is actually data that can be relied upon for our purposes?
Well, you know, it's difficult for me to speak to that in a knowledgeable way, simply because I really don't get a sense as to what comes from, right? I don't have access to those data. But, you know, certainly we've heard some concerns. I mean, I don't think that's a secret. I've seen some, concerns expressed in the media, and I've certainly seen concerns expressed by different governments, but I can't say that I know. I do say that it is very important that we work together as a global community, and I think we've seen a lot of success in that fact. The very fact that we have vaccines so fast after identification of the virus, I think, is a marker of that international cooperation and collaboration. I suppose there's always a certain amount of reticence to share. There's all kinds of geopolitical concerns, and I think that scientists also like to keep, sometimes have been known to want to keep glory for themselves when it comes to new discoveries and what have you. That's, I think, part and parcel of human nature. But I also have seen the very bright side of human nature and seen remarkable collaboration and cooperation. And I'd like to think that those forces have generally won out over those that are more nefarious.
Okay, and Dr. Davila, that kind of leads to your next question. One of our residents says that they have a home cleaner, age 40, that was otherwise healthy, that had COVID about a month ago. According to their email, the home care person or home cleaner is now healthy or COVID-free. The person, though, is in their 70s, has cancer and an immune compromised health system, and not comfortable having the cleaner in the house at this point, and wants to know if that's reasonable.
Well, I think what's most reasonable is whatever they're comfortable with, because we're talking about somebody coming into her home, or is it a she? I'm sorry, I'm not sure, but into this person's home. If there is some discomfort around having someone in the home and that's not necessary, then I would do what's most comfortable. However, what I can say is that, look, if you tested positive for COVID-19, you are generally cleared from that. For most people, it's going to be after 10 days. 10 days after symptom onset, or 10 days after the positive test, depending on what your circumstances are. And as long as you don't have a fever anymore, and your symptoms, if you have any, are generally improving. For some people, the clearance period is as long as 20 days. But that's only for those individuals who have really serious COVID-19 infections that were, in hospital and required, significant care in the ICU, that kind of thing. For those people, we tend to have a longer clearance period before we say, okay, you can get back to regular life and you don't need to isolate anymore to protect others around you. So if those are the circumstances, you stay away for 20 days, you isolate for 20 days so as to reduce the risk. That's the worst case scenario. 20 days plus, again, making sure that you don't have a fever and that your symptoms are generally getting better. That's the worst case scenario for isolation for somebody who's had a COVID-19 infection.
Okay, excellent. Thanks, Doctor. John, we do have a question from a resident that would like to know, will the Canadian government be supplying more vaccines to the province, and when?
Thus far, the province has received 200,000 vials or vaccination, and 160,000 arms have been punctured at this point. By the end of this week, the government of Ontario will receive another 138,000 vials. And so what's that? It's bringing it up to about 338,000. So at this point, we're certainly marching in lockstep with the rate of vaccination, and I dare say that that is going to ramp rather dramatically over the next few weeks. And rather hoping that the various health authorities will be able to match the rate of availability.
Okay, excellent. Thanks, John. And Mitzi, I have a question from Nima, who's a secondary teacher. She's concerned there's no asymptomatic testing in all the schools, and ventilation hasn't been updated in many of the schools. There are classrooms with window latches that don't open. And will teachers see changes in time for when classes return?
Well, as Nima knows, because of the severity of the second wave of COVID, we are under provincial lockdown, and schools will not be returning in Toronto until February the 10th for in-person learning. And that is even in doubt. I think there will be another update on that based on how we do. And if people follow the directions that Dr. Davila has been providing us with tonight, and we see a material reduction in the spread of COVID-19. It is unfortunate. I know that calling for asymptomatic testing is something that I wrote to the minister prior to the start of the school year in September to ask for that type of testing, because I really felt that the community spread in Scarborough-Guildwood was quite high, and it remains high. The assessment centers are testing in the high teens, low 20% positivity rate in Scarborough, and that's very, very high. So we still have very significant concerns around community spread and how that will affect the schools. And the need for more investments in keeping our schools in a good state of repair is something that we're calling on the government to keep up that investment and make sure that the schools do have windows that can open and keep our school environments as safe as possible. I do want to also say that with the phase 2 of the vaccine rollout upon us, we did get some provincial guidance on who is next for vaccination, and included in that are teachers as well as education workers. So those that are educating in front of the classroom, as well as those that support the school, the custodian, the administrative staff, will be in the priority phase for phase 2 of the vaccine rollout.
Okay, thank you.
Councillor, could I just add something about with schools? Because I would like to really, just emphasize a few points. First and foremost, there's no question, from my perspective, and I know I speak for the whole team at Toronto Public Health and many, many others around the province, including, I'm sure, MPP Hunter, we all want our schools to operate as safely as possible. There's no question. And I think what's interesting here, and it's a very important point, is that while COVID-19 is one risk we want to manage, we know that the benefits of having kids in school, in person, are huge. And so it's all a question of trying to get this balance right, that we want to keep our children and our teachers as well, and all the people that it takes to run schools safe from COVID-19. But we also want to make sure that our children, that's our future, right? This is the future of our city. It's the future of our country. We want them to be in school because we know how beneficial it is for them to have in-person schooling. So a couple of things. The risks of COVID-19 at school are reduced when we reduce community spread of COVID-19. So the higher the spread of the higher activity of COVID-19 in the community, the riskier it is for our schools. The schools are just they're part of our communities. So the best thing we can do to protect our schools is to follow the public health, the self-protection measures, the watching your distance, wearing your mask, washing your hands, staying home when you're sick. This is the best thing that we can all do. And by watching our distance, I mean staying at home as much as possible, minimizing your interactions to the greatest extent possible. This is really what makes a difference. The other thing, though, is that over the course of the fall, what we found in our experience at Toronto Public Health is that, yes, there were cases, especially towards the end of the term, right? September and October were actually pretty good. As we got closer and closer to the end of December and to the December holidays, there was certainly more activity within schools, but that mirrored and reflected what was happening in the community. But the other point I wanted to make is when we looked at our own investigations of cases within the schools, in the vast majority of cases, we did not find that those cases were reflective of transmission that happened in the school. They were actually reflective of COVID-19 infection that was acquired outside of school, in the community where the disease was in fact spreading. So, it offers, I think, a little bit of insight, I think, to all of us that, there are ways in which we can operate our schools safely or as safely as possible in a world where we have COVID-19 and vaccine not fully implemented yet. But it really does, I think it offers us some sign of hope and tells us and reminds us that the best thing we can do is to do our part to reduce community spread of COVID-19 if we're really interested in doing the best we can for our children and for our school communities in general.
Dr. Davila.
Let me just weigh in here on the rate of vaccination, which I don't know about the rest of you, but I hear it each and every day. So the province is currently vaccinating at a rate of about 14,000 people per day. You would presumably you would know how many people of that 14,000, how many would be in Toronto. And the second question really is, if in fact more vaccines were made available, which I anticipate that they will be, what would be a reasonable rate? What would be a way in which you would ramp up, and what could the people of Toronto anticipate as far as how many vaccinations can be done per day?
I'll admit, I don't have the exact numbers with me, but I can tell you this, that there is actually a very well-developed machinery, if you will, for the delivery of immunization throughout the city of Toronto. We have, and so when we basically harness the energy that all of us have, there's certainly a very robust plan that's been developed for the city for immunization clinics, both, what I would call as, hub clinics that are located throughout the city, geographically all around the city, with capacity to have mobile clinics, pop-up clinics, more targeted clinics on an as-needed basis, and where we notice that either vaccine isn't being taken up enough or where we know the disease is impacted disproportionately. That's just one component. Our hospital partners have certainly been absolutely key thus far, particularly with the first shipments of vaccine that came in. We know that one of those vaccines, the Pfizer vaccine, has very specific cold storage requirements. It must be maintained at -70 or colder, which is pretty darn cold. And there are only so many places that have those special freezers. So our hospital facilities were those places. And so that's why they actually were very instrumental in getting those first doses out, because they were the ones that actually had the storage of vaccine on site. But when we get to a phase where the flow of vaccine is large enough that we can engage all the family physicians and primary care providers who routinely do flu immunization, and where we can engage pharmacies who also routinely do immunization, the capacity for vaccination is really remarkable. It's thousands and thousands and thousands a day. We have almost 600 pharmacies who deliver immunization on a regular basis here in Toronto, and probably about 1,500 primary care physicians. And I'm just talking about the physicians, never mind the amazing nurses and nurse practitioners who do this on a daily basis as well. So you add to that the city's capacity and what our hospital partners are also stepping up to do, and you have an amazing, amazing machinery to really push vaccine out. We just need the supply, and I know we're putting everything we have behind this.
I'm just wondering, Dr. Davila, how will people find out when it's their turn? Like in terms of whether it's through their pharmacy or through their primary care physician? Because I think that's a question on everyone's mind is, when we do get those increased dosage, how will I know that I should go and get my vaccination? MPP Hunter, that's a great question. And I think some of that has yet to be answered by my provincial counterparts. For some people, it'll be fairly easy. So we know, for example, for those who are in certain congregate settings, long-term care homes, retirement homes, the schedule is being done and visits are being made into those environments. Those are not the only places where those kinds of visits will be made in order to facilitate vaccine. But for the broader populations, I have yet to hear specifically around what the province has in mind. But I do think that
at least part of it will be the public communications, the public facing communications that I know I certainly participate in, and many others do in communities all over the province. So that's at least part of it. But again, I think the details are still yet to be released to the public at this point from my provincial counterparts. Once they become available, I will certainly be pushing those out there through all the channels that I have. We don't want anyone to miss, if they want their earliest available opportunity for them, we want to make sure that people know where and when. And we're going to have a broad range of opportunities over time. As the flow of vaccine gets better and better, we'll be able to have more and more opportunities for people to take part and to, actually get vaccinated.
Would you correlate testing centers and vaccine centers at the same time?
I think there's some concern about that. I mean, as you can well imagine, if you're going to get tested for COVID-19, there's certainly a high risk. Presumably you've got symptoms or you have some reason to believe that you might actually have an infection. And we don't want those streams crossing each other. If you're going to do that, there may be some good reasons for which that should be done. But you're going to want to make sure that you've got solid infection prevention and control measures in place, because you're certainly not going to want to create, outbreaks within your immunization center. That would not be particularly productive.
No, I agree.
Yeah.
Okay, yeah. That's interesting.
Yeah. And is it 21 days minimum between your first dose and then second dose that you need to receive?
That's for the Pfizer vaccine. For the Moderna product, it's 28 days between dose 1 and dose 2.
Okay. All right. Thank you. And Dr. Davila, your next question. Our residents is asking, saying it's difficult to compare positive case counts over time, and wanted to know if there was a graph showing the change in percent positivity over the pandemic. And can the graph be updated and shared on an ongoing basis?
Yeah, so there actually is a place on our website, toronto.ca/COVID-19. There is a neighborhood map, and we actually show percent positivity week over week by neighborhood. I think if you go down to neighborhood, so it's toronto.ca/COVID-19. There's a section there that I believe is called neighborhood maps. They do show, because it's a section where we have the various COVID stats done by Toronto neighborhood, and you can adjust. There's a scroll button, so you can look at different views and see different information depending on what you're interested in. It is a very good resource. There are all kinds of statistics and all sorts of data and graphs that are available for people to use and to monitor, so that you know what's happening here in the city.
Okay, thank you. John, I have a question for you. It's in two parts. What is the federal government prepared to do to support Canadians throughout this new lockdown? And what is the latest in financial supports still being offered to Canadian businesses, students, and individuals? And you have to say it in less than 5 minutes.
Oh my goodness! Yeah, that's like the alphabet soup of benefits. The government of Canada, to its great credit, I think, has really stood behind the people of Canada and stepped in where there's been income fall off. So let me just rip through it, and because I think we want to get back to Dr. Davila, but the unemployment insurance minimum payment $500 a week. The Canada Recovery Benefit, $500 a week for up to 26 weeks for workers who've stopped working. The Canada Recovery Sickness Benefit, $500 per week for a minimum of 2 weeks for workers who are unable to work. Canada Recovery Caregiving Benefit, which is a big concern in our riding, because we do have a lot of caregivers in the riding. $500 per week for up to 26 weeks per household for workers, for those who are unable to work for at least 50% of the week. The Canada Emergency Wage Subsidy, up to 75% of employees' wages. Canada Emergency Rent Subsidy, direct access up to 65% for eligible expenses, and other lockdown supports. And as I say, I could put acronyms after every one of those, and people just walk away utterly and completely confused. So for those who feel that they need to access some of those benefits and are having difficulties, and you can't navigate the Canada website, which I think actually is quite a good website. If I can navigate it, pretty well anybody can navigate it. Then you can always phone my office and we'll help you through with it. So there is a lot of supports out there, and it's a massive amount of money, and the government, as I say, has been prepared to stand behind Canadians in a pretty significant way.
Perfect. Thank you, John. And under 5 minutes. Mitzi. Mitzi.
Yeah, we'll see what Mitzi does 5 minutes. Yeah.
Well, Mitzi's is only one part, John. I have Carlos would like to know how nurses are being deployed in schools. He says that since September, he's yet to see a nurse in his school.
And I believe that the nurses are not deployed to schools. They're available in a pool. That was my understanding. But as I said, schools are going to be closed for the foreseeable future, at least until February the 10th.
Okay, thank you. Dr. Davila, did you want to weigh in on that, or no?
Sure. So we you know, what I can tell you is that we do have an entire team of people, as many of whom are nurses, supporting work in schools. We have a group of people who are actually providing what I would call information and supports, what we call liaison supports to our schools, so that they can understand the administration and staff within schools know what kind of infection prevention and control measures are recommended and how best to use those. And as well, we have investigators. So when there are cases, we have people who do follow up with individual cases at school, whether it's within a student or a staff or any other, teacher or member of the faculty within schools. And while much of that work can be done remotely, if there is need for us to go to the school itself to conduct, any aspect of the investigation, we do that. And of course, we make sure that our staff are appropriately protected as they go into an environment where there are other people and where they may get exposed to disease. But there are, I can't tell you how many people there are working towards this, because again, schools are very important. We really wanted to do everything we could to ensure that the learning environment was as safe as possible for everybody in it, students and staff.
Okay. Thank you. And Dr. Davila, we have a facility in our Scarborough-Guildwood called the Masaryk Park Homes, which has a large senior population, but it's not designated as a long-term care home or a seniors living facility. And they've asked about how areas with large senior populations like that would receive their COVID vaccine, and what's being done in Toronto with similar areas with large seniors population to make sure they get COVID, although not designated, as I said, a long-term care home or a senior's home.
So, I think what's happening right now is actually largely based on the supply of vaccine and trying to put those resources where, the risk is the greatest, and towards those populations that have the greatest risk for death or serious illness as a result of COVID-19 infection. So right now, under provincial guidance, the emphasis is on long-term care homes and retirement homes. Congregate settings where we know that older individuals live and have a lot of interaction with each other. The staff who work there, essential caregivers for those sites and for the residents in long-term care or in retirement homes. That's priority number one, as well as healthcare workers, particularly those in our very pressured healthcare system right now. Our hospitals are full to the brim with patients, many of whom are COVID-19 patients. In the city of Toronto, we're, over 450 patients in hospital with COVID-19. and over 100 people in our ICU beds, again, also with COVID-19. And it's not like that's the only illness for which we need hospital or ICU beds. So this is a significant pressure on our healthcare, hence healthcare workers, particularly those who work in acute care settings, hospital type settings, are at the top of the list. As vaccine supply becomes more available, then the plan as through the provincial framework, because they're in charge of prioritizing what's next, is to go more into congregate living spaces where seniors are, to take care of adults who have chronic home care, and as well Indigenous populations, whether it's urban or remote. Those were amongst the key populations in phase 1. As we move into phase 2, then we start to get into broader populations, including those who are over 80 years of age, regardless of what their living circumstances are. But the ability to move from phases is a little bit about timing and our ramping up capacity, but it's mostly about vaccine supply.
Paul, let me just ask a question that I've been asked quite a number of times, and it has to do with these congregate settings. It's been pretty blindingly obvious since March that that long-term care facilities were going to be the major source of the outbreak. I think nationwide, it's 72% of the deaths come from long-term care. So when we were asking in May and June and July, saying, well, we know there's going to be a second wave. So what is being done, or what has been done, that is different from what was done in the initial phase? And from a lay standpoint, it doesn't look like there's actually that much. What's happening is that the ICUs are being, for want of a better term, clogged up by folks from long-term care facilities, a perfectly predictable consequence. So I wonder why, for instance, the long-term care facilities haven't been reduced in numbers, that the people spread out into, and I'm picking an example here, like empty hotels, empty motels, places that have facilities that could take care of people. So I'd be interested in your response to what's different between long-term care in March and long-term care in January.
So, and Councillor Ainsley, forgive me, I will try to make this as short as possible, but still answer the question.
The question was pretty long.
Right? Dr. Davila,
it's an important question, right? It's a very important question.
And you have all the time you want, Dr. Davila. My colleagues, John and Mitzi and I talk all the time, so we don't always need to hear each other, but we need to hear your answers this evening.
Sure.
And I'm very happy to provide them. So then I'll be still reasonably short, but cover off all the relevant points. So first and foremost, we know that the administration of long-term care homes is actually under the regulation of the Provincial Ministry of Long-Term Care. So as your local public health department, you know, we have a little limited role in respect of how long-term care homes are run. Our major role is around supporting them and providing them with a little bit of prevention, to talk about what are important things that can be done from a preventative perspective on infection prevention and control. And we help facilitate the smoother resolution of outbreaks within the context of a home. So we facilitate the movement of samples from the home to the provincial laboratory. We provide them advice. We try to help them, you know, map out the epidemiology and understand the spread of disease and offer support and advice. But the actual administration of the home is the responsibility of the home administrator, and their regulation is covered by the Ministry of Long-Term Care. I can't speak for the entire province, but I can speak for what's happened differently here in the city of Toronto based on our experience of Wave 1. And what we did here in Toronto was we made sure we partnered with our hospital partners, with the homes. And there is a system now whereby all homes, long-term care homes and retirement homes, are actually partnered with a hospital hub. Oftentimes, what has been the problem in the context of outbreaks is actually having enough staffing to manage all the care, because as people get sick and they need to isolate, the challenge is that if there isn't a lot of surge capacity on staffing, that's where you start to run into some serious troubles. So actually having hospital partners who do on the ground clinical work, both in infection prevention and control and in clinical management, in clinical support of patients, they're able to support their long-term care home partners and the retirement home partners. This was something that we discussed over the course of the spring and summer, having learned the lessons, of wave one. And so that has actually worked quite well. We have what's called a hub and spoke model. So hospitals are partnered up with long-term care homes and retirement homes. They are very actively providing support to those long-term care homes and retirement homes so that they can better manage outbreaks. Also, I can say that in preparation for wave two, we recognize from wave one that one of the risk factors, not surprisingly, is multi-bedded rooms. A lot of our long-term care homes in the city are quite old, and were made in a different time when, frankly, we just didn't know as much, I think, as a system around infection prevention and control. And so the more people you have in a room with a virus that is as transmissible as COVID-19, once it's there in a room with multiple people sharing a room, it's almost impossible to not have it go from one person to the next. You know, I'll never say never, and you never say always, but it's almost impossible, right? It's almost never going to be the case that when you're in one of those multi-bedded rooms, that it isn't going to go to all the people in that room, just because of the nature of the way this virus transmits and how very easily it goes from one person to the next, especially when you're talking about older individuals who are pretty susceptible to the virus. So one of the things that was done in Toronto was to try to, sounds like such a horrible word, but it's to decant people. So there was more space. You didn't have as many people in, multi-bedded rooms. So exactly what you spoke of was one of the things that could be done, but that can't be done for everybody. I think the challenge is that if you're in long-term care, there's a reason why you're not in a retirement home, which would be more akin to a hotel room with some supports, right? There's a reason why you need a certain level of care, and that's why you're in a long-term care home. So it's just much more challenging to provide that kind of care, even if you have staff in a hotel-like setting for a population who really is in a long-term care home. It's, we call it home because people do live there. But with our aging population, the complexity of their medical needs of those who are in long-term care is pretty remarkable. So it's just not as easy to provide. And for a lot of people, just moving them out of their environment actually puts them at risk, because there's just too much unfamiliarity, and it creates other challenges. So you're safer from a COVID-19 perspective, but you may actually be less safe from other perspectives. You don't know where you are, and that can lead to behaviors or health outcomes that are just not what you're looking for overall. So it's a very complex and challenging situation, but I don't think there's any question to my mind that we as a society need to really invest more in long-term care, and to invest more yes, we talked about students in schools. Of course, we want to invest in our future, but we should also invest in our seniors, the people who actually took care of us, right? Who gave us the opportunity to be where we are today. So it's, I do think that there's a real investment that needs to be considered, by the provincial government, I would say by the federal government as well. In what we can do to, better respect those who are older in our communities.
Mm-hmm. I want to just add to that. I completely agree with you, Dr. Davila, that in terms of long-term care, we have to make a commitment. COVID has really shown us that the vulnerabilities and the risks are just too great. We need new facilities, and more beds as our population ages. We need to rebuild some of the older facilities, those B and C locations that have multiple people to a room. But we also need to invest in those who work in those facilities and provide the hands-on care to our loved ones, and make sure that they earn a living wage and that they can earn enough so that they don't have to work in multiple homes, that they can have a full-time job in a home and earn enough to take care of themselves and their families. So there is a lot that we need to do in the long-term care, and really the continuum of care for our elderly as they are aging from retirement home, assisted living, and into long-term care type facilities. So this is something that we need, and we need to see those investments from the provincial government for sure, and perhaps the feds providing some standards across the country.
I appreciate that it's quite disruptive to decamp people to other facilities and creates other difficulties, and you'd appreciate those things far more than would I. But the cost of not doing this, where you for want of a better term, depopulate a lot of these facilities, is that the entire healthcare system just goes underwater. The reason for the lack of ICU beds is that people are getting sick in these homes and ultimately being transferred to the hospital, and in many cases dying. Some recover, of course. So the cost of not depopulating seems to me to be far in excess of the disruptions that would be attendant upon for a population that is in real difficulty.
Yeah, I think that, and that's why there was some movement to try and reduce the burden within long-term care homes. So there's no question that was done where it could be done. But interestingly, with this wave in particular, we've seen a younger demographic impacted, and they're actually representing a goodly proportion of that, of those numbers, of those hospitalized and those in ICU as well. So I think the other interesting thing, unfortunately, based on, and I can't tell you exactly, off the top of my head what the proportions were, but certainly in wave one, and I would say as well in wave two, just given the nature of the population that is in long-term care homes, of those who actually get sick with COVID-19 and die, a goodly number of them never made it to ICU, just because they were so badly affected. Just given the conditions that they're in, that's what their pre-existing medical conditions are why they're in long-term care, and made them exquisitely sensitive to COVID-19. And the problem is that once a virus like COVID-19 that transmits readily and transmits from people who don't even have symptoms, right? Once that kind of virus gets into a home, it's actually very, very difficult to manage. So the real trick there is to actually keep it out of the home through a bunch of measures, infection prevention and control, and actually reducing, as MPP Hunter was speaking of, the more we were able to focus workers to one home only, and the better we could be about supporting them to stay home when they're sick, or to isolate if they were worried, or quarantine if they were worried that they might have been exposed, the more successful that home would be in terms of reducing the opportunity for introduction of COVID-19 into the environment.
Yeah, and I do believe the federal government stepped up with a supplement, which I think has been helpful. Sorry, Paul.
No, I was just going to say, I have friends of mine that work in long-term care homes, and one of the frustrations that they had is, a lot of the dynamics that Dr. Davila just spoke about, and at the same time, provincial officials saying that they had to put a ring of iron around long-term care homes to prevent a second wave of COVID. And my friends are like, there's there's no such thing as a ring of iron that you can put around long-term care homes to prevent COVID from coming in a second wave.
Well, the best thing you do is you reduce community spread in the first place, right? That's the best thing that we can do.
Yeah. Yeah.
I'm just wondering, Paul, if I could just ask, because we just heard the update on the provincial modeling for COVID-19 for the second wave, and it's very, very, jaw-dropping really to see the risk of doubling. But the real unknown is the variant. So there's the UK variant, the South African variant. We know there are 14 known cases in Ontario. How concerned are you for Toronto for this variant overlaid on an existing fight that we have? And I asked the question from our perspective here in Scarborough-Guildwood, where we know that community spread is a serious risk. We know that many families live in multi-generational, multi-family settings, and so it's very difficult when the virus infects one person in the home for the others to keep safe from it because they're in shared facilities. So what are you most worried about? What keeps you up at night about that variant of the virus?
So, for me, when I think about the variants of concern, and there's more than one. At this point, while we don't have all the answers, what we do understand is that there appears to be greater transmissibility associated with certain variants. Yeah. And so with greater transmissibility comes the risk of even further acceleration of COVID-19 spread in our community, particularly if we are not successful in maximizing distance between the people who live in this city, right? Keeping our distance and really, limiting our interactions to the greatest extent possible with the people with whom we live, right? That's really what we want people to do. So that would still be first and foremost. It just reminds us that we really do need to do this stay home as much as possible, only going out for those essential activities. In light of variants of concern, which are we believe to be more transmissible, at least that's the current state of evidence, and we're going to continue to monitor for this. It really just hits that message home. I think the other component, of course, is it's winter. Mm-hmm. So the air is cold and it's dry. And this is flu season for a reason. And it's because respiratory viruses, which includes coronavirus, which is what causes COVID, SARS-CoV-2, SARS coronavirus 2 is what causes COVID-19. Like other respiratory viruses and other coronaviruses, it transmits better in cold, dry weather as opposed to more humid conditions. So we've got variants of concern. We've got winter weather and conditions that promote virus spread. And on top of it, because it's cold, we spend more time indoors. So especially if we're mixing it up with other people, with colder weather, you're not socializing if you are socializing, which you shouldn't be. But if you were, you're generally not going to be socializing outside because of the weather. So, you can see how these things all together can lead to, even more accelerated growth when it comes to COVID-19 cases. And this is exactly what we don't want. If we are seeking to preserve our own health, the health of those around us, and certainly our healthcare system, which is already under great pressure. So that's my concern around these new variants, and just redoubles my efforts to try to really hit home the point of, stay home as much as possible. It really will make a difference. And as we get vaccines out there, the more we can reduce the amount of COVID-19 in the community, the more successful we will be with our vaccination undertakings as the supply becomes more and more available.
Dr. Davila, we have, in Scarborough-Rouge River, we have 5 neighborhood improvements, Scarborough-Guildwood Now I'm mixing up my areas. We have 5 neighborhood improvement areas that are very high density: Woburn, Scarborough Village, Mornell Court, Kingsborough Galloway, Morton Park. And one of the questions is around screening, and should wider screening be done to identify asthmatic people and prevent further COVID-19 outbreaks?
So, there are a lot of questions around this, and I think what I'm actually very interested in, and so are many other people within the public health community, the challenge is that our current test is an excellent test. Like it's very sensitive, but it is pretty intrusive. I'm not sure, have any of you had to have a COVID test?
I never leave my house.
Disclose, like pushing into personal health information. You don't feel obliged to answer. But it's actually the same test that's often done for influenza as well, if you ever have an influenza test. It is a nasopharyngeal swab, so it's quite intrusive. It goes all the way up, way back to the top of your nose. So it's not a pleasant sensation at all. And it does require right now, going to a testing center to have a regulated health professional to provide that test. So it's pretty... It's labor intensive, it's complicated, and frankly, it's really uncomfortable. We know that there are increasingly rapid tests available that are easier to use and just less likely to cause discomfort, saliva tests and the like. And while they're not as good, they're not as sensitive as picking up disease or finding disease when it exists. You can imagine, I'm not going to bore you with all the details of testing and sensitivities and specificities. There's all this wonderful stuff that we have to do in the world of public health. But the short version of the story is that even if you take a test that isn't as good as our gold standard in terms of identifying disease when it exists, if it's relatively cheap and can be done on a more regular basis, you may be able to make up for the fact that it's not as sensitive as picking up disease as our current gold standard test is. So this is one of those opportunities that I think we might want to consider. When might we use rapid tests? Are there particular circumstances? Might it be in a long-term care home? Might it be in a certain work environment, especially large work environments? Could these be the kinds of places where we could deploy rapid tests to help us pick up new cases of disease in our community, and especially in areas where there's lots of density and lots of people? So that's just some thinking on what we might be able to do. But I would also remind people now that, because for some people, COVID-19 presents so mildly, to the extent that people are able to really sort of be mindful about how they're feeling and whether they notice that they've got, even if it's a little sniffle, that just seems different to them, right? Or a mild headache. Oh, I have this funny headache. We're asking people to actually err more on the side of caution, right? If you think that you might have a symptom, best to stay home and avoid others, and not risk that you might be spreading COVID-19. Because sometimes it starts off very mildly, and then all of a sudden you realize, oh, wait a minute, I am sick, aren't I? And by then you may have spread to other people. So to the extent that people can really, watch themselves for symptoms, that would be helpful as well.
Just wondering, Dr. Davila, in your public health conversations, and I do want to use this as an opportunity to thank you and your colleagues. There were times when I would watch all of your updates and all of your colleagues' updates and across Canada updates with the medical officers and updates. And I'm just wondering if you have really pushed for a more rapid rollout of these types of tests that can be used for workplaces, schools, and other settings in a more user-friendly way, as one of the tools of fighting the community spread of the virus.
Mm-hmm. So yes, in a word, yes. And in fact, at Toronto Public Health, we participated in a number of pilots. to look at exactly this issue and to determine, is this an opportunity? Is this a good technology, if you will, for scaling up to provide greater benefits? So those are the kinds of endeavors that we're working on and are continuing to work on with both research partners and some provincial partners as well.
Just out of curiosity, is the spit test adequate for the purposes of international travel?
As far as I understand it, they're relying on, they want PCR testing for international travel. That's my current belief. I'll have to double check. I don't think that there are for international travel. I believe the requirements are for a PCR test.
All right. PCR test meaning up the nose.
Mm-hmm.
Yeah, which is very intrusive.
Sadly, yes.
It makes me stay home, John, and friends of mine have had it. It makes me stay home. Just the threat of it, thinking about it, makes me only go out grocery shopping. Dr. Davila, I think we're getting close to the end of our list of questions. We have had a number of questions, though, around small businesses and how they can reopen, and a lot of small business owners around the fact that they might only have 2 employees in their shop, and they don't see why they can't have 1 or 2 customers in the shop at a time, and what can be done in terms of sanitation and distancing rules to get them open as quickly as possible.
So, without, getting into too many details, right? The current rules that are in place in respective businesses have been put forth by provincial counterparts. Those are it's all under the Reopening Ontario Act and the different stages of that. That being said, I do think that we do need to start looking forward towards how do we reopen safely, right? As we start to, hopefully get COVID-19 rates down in the city. We do want to see those numbers come down, obviously. We certainly want to see vaccination rates go up. And, we need to start thinking about that point in time where we will, start to see declines in COVID spread and increases in protection as a result of the rollout of immunization. And what then might we be able to do about ensuring as safe as possible environments for all of us, including small businesses and retail and all the different things that actually make life in the city what we all love about life in the city, right? We all want to get back to those kinds of interactions and, ability to go out and frequent businesses, whether we're talking about, restaurants or coffee shops or retail environments. We all want to get back to some semblance of life as it used to be. It will take time. It will absolutely take time. But I do think that there is, at some point in the future, this is the kind of thing that we're going to need to talk about. And I know that there's a provincial table that discusses these things. I can tell you that public health professionals all over the province are constantly discussing these things. And actually, when you think about it, it's public health people the world over are trying to figure out, how do we do this? The good news is that we know that when you can get disease rates down, and hopefully as we see protection go up, there are ways to do this as safely as possible. We've seen other jurisdictions have some success in this regard. And I can tell you that certainly at Toronto Public Health, we have no qualms about borrowing shamelessly from others' success, as we should. That's called not only relying on scientific evidence and the literature, but you want to look at what are the experiences of other jurisdictions. Where have they been successful? We don't have to make the same mistakes as others if we can at all avoid them. So certainly we do look to the experiences of other jurisdictions all over the world to try to inform that.
Excellent. Excellent. Well, I think at this point we've really enjoyed your questions, the answers you've given this evening, and I think we're going to wrap this up, Dr. Davila. Was there anything you'd like to say in conclusion, or?
Well, I think first and foremost, I would say thank you. Thank you to you, Councillor Ainsley, MPP Hunter, MP McKay. Thank you for allowing me to be here with you. More importantly, thank you to the people of Scarborough-Guildwood. We heard that many of you are essential workers and have been the frontline heroes, frankly, of the last year. And I expect we're going to be calling on your heroism for some months more. So I would ask that you stay strong and stay safe. And, please know that, the people at Toronto Public Health are behind you 110% and are doing our very, very best to try to create as safe an environment as possible. And as vaccine becomes more and more available, we will do our utmost to work with all our partners to get that vaccine out as quickly as possible so that we can afford that kind of protection to as many people as possible, as quickly as possible. In the meantime, I would just ask that everybody please, as much as possible, wherever possible, stay home and only go out for those essential activities, essential work, grocery shopping, getting your pharmaceutical needs, attending healthcare, and getting some exercise. And of course, if you're a pet owner, you got to take your pets out. That's part of that too, right? We can't forget our furry friends. But, if you can really stick to that, and if you're out and about, whenever you go out of your house, wear your mask as much as possible. Wash your hands. Stay home if you're sick. If you think you're sick, stay home. I know that if we do those very simple but powerful self-protection measures, that's the best thing that I think we can all do as a community to protect ourselves and to protect our entire city from COVID-19 at this point in time. So thank you again, and I hope you'll invite me back.
Next week. It's good.
Betsy, do you have some closing comments?
Oh, that was such a good comment from my colleague there, MP McKay. Dr. Davila, you are a remarkable public servant, and we thank you for the work that you and your team are doing to keep Ontarians and Torontonians as safe as possible. And, we will do our best in our community to share the great public health advice that you put out on a daily basis. And to the residents and the community members and those who are watching, we know it's challenging. Lockdowns are not easy. If you need help, please call 311 or 211 and get the help and the support that you need in your life. Being self-isolating and staying at home it should not be a lonely experience. You should still feel the support and the togetherness of your community through this pandemic. So we wish you good health for 2021, and we will get through this together. If there's anything my office or I could do, please give us a call. We do have a staff member there each day. The office is closed, but we're answering the phones and also answering emails and the information coming through our social media as well. So please do reach out. And if I just want to share that I do have my virtual levy happening on Sunday afternoon. It'll be at 2:00. And it's just an opportunity for us to come together as a community for some uplifting moments. So please join in. You can find the link just on my Facebook or Instagram at MPP Mitzi Hunter.
Excellent. Thanks, Betsy. John, any concluding comments?
Well, I too wanted to thank Dr. Davila for her straightforward answers to straightforward questions. And, these are questions that have been running around in people's minds for quite a bit of time. And so I appreciate you coming and talking to us. I know that doctors love to give out advice. I also know that doctors don't necessarily follow their own advice. But in the event that you are wanting to have a period of exercise, I would invite you to get on the GO train and come to the Guildwood GO train and find the Highland Creek Trail. The Highland Creek Trail will take you 19 kilometers through Morningside Park, through the University of Toronto Scarborough campus grounds, through the Highland Creek, Lower Highland Creek, and you'll walk along the waterfront trail to the Rouge Park GO station, and then you can go home. So it's a lovely walk. And we offer it to all doctors under distress. So,
so again, that is your prescription for good mental and physical health.
There we are. And I didn't even charge you for it. It's pretty good.
Well,
Yeah.
Well, you can. I'll give you my OHIP number.
Yeah.
Maybe you can bill.
There we go.
Thank you, John. Thank you, Mitzi. Dr. Davila in particular, thank you very much. I know how busy you are, and taking the time out of your very hectic schedule to answer the questions from our residents. There's many more questions, and I encourage people, if they didn't hear an answer to their specific question, to either reach out to myself, Mitzi, or John in our constituency offices. We're always available to the best of our ability. We have a wonderful neighborhood here in Scarborough-Guildwood. As John said, when we talk about getting out to exercise, we have some of the best green space, the Highland Creek Trail, the Scarborough waterfront. So please get out there, get your exercise. But as we've said many times, and can't say this enough, each and every month, stay home. I know it's difficult, but please only leave your home if you absolutely need to. Please stay in your bubble. I know that everybody wants this COVID over as quickly as possible, but the rules are there. Our healthcare professionals, in particular, Dr. Davila, have put them there for our health benefits. So please follow them and stay home. And I'd like to wish everybody a happy, healthy New Year. For those celebrating Happy Pongal at this time of year. And Dr. Davila, probably won't be next week, but we certainly would like to have you back again.
Yeah.
Well, I'd be honored to come back.
And I'd also like to say I have a new committee assignment. I'm been placed on the board of directors of the Toronto Public Health, and my first meeting is on Monday, and I'm looking forward to the work and working more with Dr. Davila. So thank you very much, Doctor.
Thank you.
Thank you, everybody. Take care.
Take care.